Sleep is one of the most essential functions of the human body. It restores energy, repairs tissues, regulates hormones, and allows the brain to reset emotionally. Yet millions of people suffer from sleep disorders that disrupt these vital processes. At the same time, depression affects hundreds of millions worldwide. What many people don't realize is that these two conditions are deeply intertwined. Sleep disorders and depression often feed into each other, forming a cycle that becomes difficult to break without proper awareness and treatment. Understanding this connection is key to protecting mental health and restoring emotional stability. One of the most common sleep disorders linked to depression is insomnia. Insomnia involves difficulty falling asleep, staying asleep, or waking up too early and being unable to return to sleep. When someone lies awake for hours, their mind becomes restless. Thoughts may race, worries intensify, and emotions feel heavier. Lack of sleep weakens the brain's ability to regulate mood. Emotional resilience drops, irritation rises, and concentration becomes fragmented. Over time, insomnia leads to chronic fatigue, which increases vulnerability to depression. Many people develop insomnia during stressful periods in life, but when it becomes long-lasting, the emotional consequences can be severe. Another major sleep-related issue connected to depression is oversleeping or hypersomnia. People with depression often sleep far more than usual, sometimes 10, 12, or even 14 hours, yet still feel exhausted. This is because the sleep they get is not restorative. Their brain chemistry is disrupted, preventing them from reaching deep, rejuvenating stages of sleep. Oversleeping creates a sense of heaviness, fogginess, and disconnection from daily life. It also lowers motivation and energy, leading to reduced activity and social withdrawal, two behaviors that further deepen depressive symptoms. Poor sleep quality is another major contributor. Even when someone gets enough hours of sleep, the sleep may be fragmented, shallow, or frequently interrupted. Many factors contribute to poor sleep quality, including stress, anxiety, hormonal changes, caffeine, alcohol, inconsistent sleep schedules, and excessive screen time. When sleep quality is low, the brain struggles to regulate emotions, store memories, and process stress. This creates the perfect environment for depression to develop. Depression also directly affects sleep patterns. People with depression often describe lying awake at night, replaying negative thoughts. The brain becomes hyperactive instead of calming down. Some wake up extremely early, unable to return to sleep because their mind feels heavy or anxious. Others experience middle-of-the-night waking, leaving them drained the next day. Depression creates emotional turmoil that makes the brain unable to shift into the restful state required for sleep. The relationship between sleep disorders and depression is bidirectional. Poor sleep increases the risk of depression, and depression worsens sleep disturbances. This creates a cycle that is difficult to break. For example, someone with insomnia may begin experiencing low mood due to exhaustion. That low mood increases stress and anxiety, which in turn makes sleep even harder. Over time, the insomnia evolves into depression. Similarly, someone with depression may sleep excessively, feel unmotivated, withdraw socially, and become less active. Lack of movement and sunlight then disrupts the sleep-wake cycle, worsening depression. Hormones also play a major role in this relationship. Cortisol, the stress hormone, increases when a person experiences anxiety or depression. Elevated cortisol levels at night make it difficult to fall asleep. Similarly, serotonin, the neurotransmitter associated with mood and sleep regulation, decreases in people with depression. Low serotonin disrupts the production of melatonin, the hormone that signals the brain when it's time to sleep. This disruption causes irregular sleep patterns, making emotional regulation even harder. When serotonin and melatonin become imbalanced, both sleep and mood decline sharply. Another important factor is the circadian rhythm, the body's internal clock. The circadian rhythm controls when we feel awake and when we feel tired. Depression can disrupt this rhythm, causing individuals to feel sleepy at unusual times or awake when they should be resting. Irregular routines, late-night screen use, and shift work can intensify circadian disruptions. When the internal clock becomes misaligned, it becomes harder to maintain emotional stability. Lifestyle factors also contribute to sleep-related depression. High caffeine intake, lack of exercise, excessive screen time, and inconsistent sleep schedules all weaken sleep quality. Using phones and laptops before bedtime exposes the brain to blue light, which suppresses melatonin production and keeps the mind alert. Many people scroll through social media late at night, comparing themselves to others or absorbing negative content, creating stress and emotional tension right before trying to sleep. Stress is another major cause of both sleep disorders and depression. When the mind is overwhelmed, the nervous system remains in a state of alertness. Muscles stay tense, the heart rate stays elevated, and thoughts continue racing. This prevents the brain from entering the relaxed state required for sleep. Over time, chronic stress leads to sleep deprivation, which weakens emotional resilience and increases vulnerability to depression. The body perceives lack of sleep as a threat, triggering more stress hormones, which create a cycle of emotional exhaustion. Medical conditions also play a role. Sleep apnea, chronic pain, restless leg syndrome, migraines, and hormonal imbalances can disrupt sleep. When sleep disturbances become chronic, they affect brain chemistry, emotional regulation, and energy levels, greatly increasing the risk of depression. Treating the underlying medical condition often improves both sleep and mood. The good news is that the sleep depression cycle can be broken with awareness and proper treatment. Improving sleep habits, often called sleep hygiene, is one of the most effective strategies. Consistent bedtimes, limiting caffeine, reducing screen time, creating a calming sleep environment, and avoiding naps late in the day all support healthy sleep. Relaxation techniques such as deep breathing, meditation, and light stretching help calm the mind before bedtime. Exposure to natural light in the morning helps reset the circadian rhythm, improving sleep quality at night. Therapy, especially cognitive behavioral therapy for insomnia, CBTI, is one of the most effective treatments. CBTI helps individuals change negative sleep patterns, challenge anxiety around sleep, and establish routines that encourage deep rest. When depression is involved, therapy helps individuals understand emotional triggers, build coping strategies, and address underlying stressors. In some cases, medication may be necessary to stabilize mood or regulate sleep, especially when symptoms are severe. Physical activity is another powerful tool. Regular exercise increases serotonin and endorphins, reduces stress, and promotes deeper sleep. Even light activities such as walking, stretching, or yoga can greatly improve both sleep and mood. Nutrition also matters. Avoiding heavy meals, alcohol, and sugary foods at night helps maintain stable brain chemistry. For individuals with severe insomnia or sleep apnea, medical evaluation is important. Treating sleep apnea with CPAP therapy, adjusting medications, or addressing chronic pain can dramatically improve sleep quality and reduce depressive symptoms. In conclusion, sleep disorders and depression are closely connected, forming a cycle that affects both physical and emotional health. But this cycle is not permanent. With awareness, lifestyle changes, therapy, and proper treatment, individuals can restore healthy sleep patterns and improve their mental well-being. Sleep is not a luxury, it is a necessity. When we prioritize rest, we strengthen our emotional resilience, improve our thinking, and support the mental health that carries us through every day. Healthy sleep leads to a healthier mind, and a healthier mind leads to a better life.